pure fentanyl, it is fire. Like, it is so dangerous. It's like the most horrid, wretched, pure terror you can imagine.
Since childhood, we are fed with cartoons, where good always wins, where everyone has a chance. And then we grow up, spot the homeless on American streets, and realize that life has never run on a Disney script. We believe America is paradise, but when we look at Kensington, we get it. Movies are just movies, and real life is so brutal that the main characters end up curled up on the sidewalk. Under the L train, the ground shakes, littered with damp trash and the sharp scent of chemicals. The figures sway unsteadily, gaunt and still, frozen in motion as if time itself is stuck. The wail of ambulances cuts through the air, mixed with the sound of rolling carts from volunteer groups, bringing bandages, hot soup, and hurried questions. The homeless community in Kensington is a living contradiction to everything we've been told about the American dream. Here, the harsh reality is more brutal than any narrative. Addiction, poverty, and abandonment collide in plain sight, exposing a truth most people never knew as children. Not everyone gets a happy ending, and not everyone is given a chance. It's the raw portrait of a community pushed to the edge, where compassion isn't a choice, but a command.
Oh, these people are getting beat up bad, like they're sleeping and they'll come with like big cinder blocks and they'll bang their head. And
have you seen that type of stuff?
I've like heard the cries and the screams. It was hard, it's sad, it's crazy.
The statistics are heartbreaking. In 2024, 5,129 homeless people in Philadelphia on just one night, up 9.8% from 2023, according to the city's point-in-time survey. These numbers aren't just data, they're resilient lives waiting for us to step up. Let's dive deeper into the souls of Philadelphia's homeless. Stories of conflict, extraordinary strength, and urgent pleas for change. What hidden truths will shock you next? Behind every tent lining the sidewalks of Kensington is a story of loss, not failure. Since the 1,990 seconds, redlining policies and decades of disinvestment have shaped the fate of this neighborhood, pushing a once resilient community into a constant struggle for survival. Today, Kensington faces a poverty rate of around 45%, while Philadelphia lacks more than 64,500 units of affordable housing, a number that forces many families into the cruel choice between paying rent and putting food on the table. These figures are anything but abstract. They represent real people losing their stability little by little with every shrinking paycheck. And just as the social and economic foundation had no time to recover, the opioid wave crashed in like a new storm. It began with painkillers marketed as relief, but quickly escalated into addiction, grief, and despair. Now, fentanyl and xylazine haunt streets across Philadelphia, contributing to a rise in the number of people sleeping outdoors. The unsheltered population has reached 976 individuals, accounting for 18.8% of the city's homeless, a jump of nearly 10% from the previous year, according to the 2024 pit count.
Pure fentanyl, it is fire. Like, it is so dangerous. It's like the most horrid, wretched, pure terror you can imagine. And it feels like something slowly, like, just pulling your life force out of you. And then you get tunnel vision, starts getting smaller and smaller. And around this tunnel, it's just darkness, right? And it gets smaller and smaller and smaller and closes, and it goes, you're dead. That's it.
You think you're dead?
No, you're dead. You're a flat line, no heartbeat, dead.
Kensington is the epicenter of the crisis. This area accounts for roughly 35% of all unsheltered homeless individuals in the entire city. And the number of people sleeping outdoors here has risen by about 23% in just 1 year. These aren't just figures in a report. They're cries for help echoing every night from the cracked sidewalks. Yet, even in the midst of that chaos, quiet moments of humanity still break through. Volunteers from Prevention Point, Philadelphia walk these streets every day, carrying clean supplies, tending to wounds, administering naloxone, and most importantly, holding on to the hope that today, even if it's just one person, someone might survive. Kensington's crisis is not just a local issue. It is a mirror reflecting decades of neglect, failed policies, and a lack of compassion on a national scale. Advocates continue to push for housing-first solutions, treatment programs centered on healing instead of punishment, and a support system that truly values human dignity. Because right here, among the weary faces and the tents trembling in the wind, there is still something that cannot be broken. The will to survive, the care people show one another, and the belief that even the most forgotten deserve a future. For those living around Kensington, each passing day feels like walking between two worlds. The place they call home and a place filled with wounds that have never truly healed. Many describe life here as a journey marked by constant worry and exhaustion. They watch people addicted to drugs collapse right outside their doors, walk their children to school along streets littered with needles, and clean their sidewalks every morning as if it were an unavoidable part of daily routine. A resident in Harrogate shared that moving just a single mile changed her life completely, forcing her to directly confront every issue related to the opioid crisis, simply because of my new address. Heartache also weighs heavily on many families who love their neighborhood yet feel trapped in a chaos that has dragged on for far too long. I can feel the pain and despair every time I walk through this area. We don't deserve to live like this, another resident said. Even so, a faint sense of hope flickers as the city begins cleaning up, reducing crime, and rolling out new safety programs. Still, residents say the improvements remain slow and fragile, like a soft breath in the middle of a storm. Beyond exhaustion, many residents also feel watched and exploited. The rise of trank tourism, where TikTokers or YouTubers come to Kensington solely to film people struggling with addiction, has left locals feeling hurt and furious.
Grace of God.
They say their community
Please bless.
is being treated like a disaster attraction instead of a neighborhood deserving real respect and meaningful support. Even so, residents continue to show resilience, cleaning the streets, organizing activities for children, looking after their neighbors, small but steady efforts to preserve the humanity of this place. In the end, the people of Kensington live between fear and hope. They want change, they need change, and they're calling for the city to take real action, not just draft plans on paper. But no matter how overwhelming the crisis becomes, they keep standing strong, holding their community together with compassion, perseverance, and the desire for a safer, healthier neighborhood. Nonprofits in Kensington aren't just organizations, they're lifelines. The New Kensington Community Development Corporation, NKCDC, stands at the center of this support network, bringing together housing counseling, small business assistance, job training, and community health outreach into one unified mission. With a trauma-informed, equity-focused approach, NKCDC helps neighbors clean up vacant lots, create affordable housing, and protect longtime residents from being pushed out. In 2025, they opened the Kensington Engagement Center near McPherson Square Library, a place where people can access health services, legal guidance, mental health awareness programs, and counseling under one roof, a vital form of government social support in a growing public health crisis. Another crucial pillar is Prevention Point Philadelphia PPP, best known for its harm reduction work and daily street outreach. Their Wellness on Wheels program delivers naloxone, wound care supplies, case management, and addiction treatment programs directly to people where they are. PPP also operates syringe service programs, drop-in centers, and transitional housing like Beacon House, giving hundreds a chance to regain stability through opioid addiction recovery and substance abuse rehabilitation. Their outreach teams out on the streets 5 days a week walk with people step by step toward treatment, housing, and safety, a powerful example of effective nonprofit outreach programs. Rounding out this safety net is Project Home, which offers medical support through the Epstein Street Medicine Program. Their teams treat chronic illnesses, infections, and opioid-related conditions right in the heart of the community. Project Home also provides supportive housing and job training, helping people rebuild their lives with dignity and independence. Together, these nonprofits form the backbone of hope in Kensington. Their shared efforts turn compassion into measurable action, proving that when a community invests in care, resilience grows stronger every day. Real change in Kensington will take more than scattered help. It calls for a connected, long-term plan built on compassion, creativity, and community. Beyond meals and temporary shelter, the future of Philadelphia Kensington depends on rebuilding trust, strengthening neighborhood pride, and giving residents true ownership in the process of recovery. A new beginning could start with innovative housing options like modular microhomes placed on empty lots, creating private, safe, and affordable living spaces while cutting down construction time and cost. Cities such as Seattle and Austin have already tested similar models, lowering chronic homelessness by nearly 30% in designated areas. In Kensington, a project like this could blend city funding with with nonprofit workforce programs, hiring local residents for construction and upkeep, turning people who once needed help into partners in rebuilding their own community along the Philly streets that raised them. Economic opportunity must also sit at the center of any lasting solution. Growing local training hubs connected to neighborhood businesses could prepare residents for jobs in fields like renewable energy, food service, or digital trades, industries that continue to grow even during tough economic cycles. Partnerships between Project Home, community colleges, and private companies could build a circular system where education, jobs, and mentorship support one another. Meanwhile, accessible health centers focused on addiction treatment and mental wellness must remain key. Bringing together mobile clinics and community-based support groups would help fill the gaps in care and restore dignity through reliable, consistent services for the Philadelphia homeless community. The larger goal isn't just giving people a roof, it's rebuilding a sense of belonging, weaving safety, opportunity, and compassion into a stronger social fabric. With honest funding practices, active cooperation, and a shared commitment to stop accepting decline as the norm, Kensington can shift from a symbol of struggle to a model of revival. Change won't happen overnight, but every small effort, every step forward, brings the neighborhood closer to a brighter and more just future. Kensington's stories are full of grit and determination, yet the funding meant to help people often disappears into unclear system. In 2025, Philadelphia set aside $12 million for homelessness programs, but small frontline groups like Prevention Point, serving more than 1,500 people every month with meals, medical supplies, and basic care, still struggle to keep their doors open even as outsiders show up for a Philadelphia walking tour to witness the reality of Kensington drug culture firsthand. A new proposal to create a homeless services ombudsman comes with a $500,000 budget designed to close these gaps and make sure money actually reaches those who need it. At the same time, blockchain is showing real promise. It allows every dollar from the city, donors, or community fundraisers to be traced directly to what it's paying for, whether that's job training or housing development. A pilot project in San Francisco in 2024 used the same approach to distribute $1 million in aid. The result? Efficiency jumped by 30%, and 85% of the money went straight to frontline services. Bringing that model to Kensington could strengthen Prevention Point's mobile clinics, which serve around 200 people each week. When people can see exactly where their contribution goes, like $50 feeding someone or $200 helping with housing, it builds trust and cuts the 20% bureaucratic waste seen in 2024. Accountability shifts the focus back to people, not paperwork. It ensures every dollar has a purpose and creates real change. So how do we make sure aid truly reaches lives on the street? As we turn towards social enterprises, the need for transparency becomes even clearer. What kind of business would you bring to Kensington to spark change? To me, transparent systems aren't just efficient, they're fair. And when trust becomes the foundation, whole communities grow stronger with every dollar invested. Kensington's empty lots carry the promise of rebirth, waiting for the right hands to shape them. Back in 2020, nearly 50 vacant parcels sat unused, each one a blank canvas ready for social-driven businesses to spark real change. Imagine co-op cafes, or community farms, employing hundreds of residents, especially those trying to rebuild their lives, offering not just paychecks, but a fresh sense of direction. Picture a small bakery on Allegheny Avenue bringing back talents like Maria's, where she could teach others her craft and help them find their footing again. A real-world model already exists. In 2024, Homeboy Industries in Los Angeles showed what's possible, helping 65% of participants secure stable jobs. It's a blueprint Kensington could adapt, training roughly 200 locals each year in gardening, culinary work, or crafting items from reclaimed material. Efforts like these breathe life into the local economy, with the City Council potentially supporting them through tax breaks or low-cost leases. And with Kensington sitting just about 2.5 miles from downtown, a 2025 analysis marks it as prime ground for small community-run enterprises. Crowdfunding could rally support from across the country, fueling neighborhood markets where handmade goods strengthen local pride. At its heart, this kind of ecosystem gives every resident a chance to take part in rebuilding, turning forgotten corners into hubs of opportunity, jobs, and dignity. When we put people first, we lift the spirit of Kensington, proving that resilience can reshape even the hardest hit places. What kind of social venture can you imagine taking root here? And how do these ideas push us to rethink what community support really looks like? The more I reflect on it, the clearer it becomes. Social enterprises aren't just businesses, they're pathways to independence, showing that when we invest in people, the whole community rises. To understand homelessness in Kensington, you have to look beyond statistics and policy reports and listen to the people living beneath the rumbling L. Behind every tent on Kensington Avenue is a story shaped by loss, trauma, and decades of systems that broke long before addiction ever took hold. Many here once had steady jobs, families, and a sense of normalcy. A medical injury, rising rent, layoffs, or untreated mental health struggles pushed them to the edge, showing that homelessness in Philadelphia, Kensington rarely has a single cause. On the Philly streets, the same ones often shown in Philly Streets documentary videos, you'll meet people like Marcus, a former construction worker who spiraled into homelessness after a back injury and medical debt, or Elena, who escaped domestic violence but found the shelter system overcrowded and unsafe. For many, fentanyl or xylazine began as desperate attempts to quiet pain, not the lifestyle outsiders assume. And yet, even here, small communities form. People share food, blankets, and warnings about dangerous drug batches. What hurts most, many say, isn't the cold or hunger, but being treated as invisible. Pedestrians avoid eye contact, media crews record them without consent, and some come at night to film Philadelphia nightlife chaos instead of offering help. Still, hope remains. When asked what they want most, their answers are strikingly simple. A job, a room of their own, a chance to begin again. These stories remind us that the people of Kensington aren't the crisis. They're the casualties of years of neglect. Real solutions must begin with seeing their humanity. Any plan for Kensington's future must keep their voices at the center, because change that forgets people isn't change at all. Kensington is more than a headline, more than a crisis zone, and more than what the world sees in viral clips. It is a neighborhood filled with people fighting every day to survive, to stay hopeful, and to reclaim pieces of their lives. The tents, the addiction, the poverty, none of it happened overnight. It grew from decades of disinvestment, broken systems, and a lack of compassion at every level. But just as the crisis didn't form in a single moment, the path forward won't come from a single solution. Real change will depend on listening to the people who live here, those who walk these streets, and those who have been overlooked for far too long. Housing, treatment, community pride, transparent funding, and meaningful job opportunities must work together, not as temporary fixes, but as long-term commitments. Kensington is often called America's warning, but it can also become America's example. An example of what happens when a city chooses care over neglect, solutions over silence, and humanity over stigma. The future of Kensington won't be built by outsiders looking in. It will be built by the people who have endured the most and still refuse to give up. And that resilience is where hope begins.